Now, reading about the biography of a surgeon called Neer, and when I reached around the contribution he made, I got to see that this was one of the contributions he made to orthopedic. He brought in what is known as a Neer prosthesis, and he also brought in what is known as a Neer's classification of humeral fractures, which we previously looked at. So let's look at the Neer prosthesis now. So this is a prosthesis. A prosthesis is basically anything I'm using to replace the bone at a joint. Do you understand? So the Neer prosthesis is mainly for the shoulder. Okay. So the head of the humerus is having an issue, and I carve through and I put something that will replace it, so that what the function of this person at the shoulder joint is still maintained. So this is a Neer's prosthesis. So Neer's prosthesis, just like I told you guys, I was reading about the biography of Dr. Charles Neer when I came across his contribution, and this was one of his contribution. He was a pioneer in modern shoulder surgery. He was actually it was one of the earliest prosthetic designs that he designed it. And it was one of the earliest things that at least could give hope to people that had severe shoulder trauma. It was for shoulder arthroplasty, okay, mainly joint replacement. So what is it? It's a metal prosthesis, okay. It is designed to replace a humeral head, which is the ball of the shoulder joint. Different ones, different sizes for different age groups. So it's used when the natural bone has been damaged, so it cannot heal properly, such as in all those complex fractures. So it can be used as hemiarthroplasty, where you are replacing only the femoral head or part of the total shoulder replacement. Okay, you can combine it with a glenoid component. I don't know if you understand. Like, you replace this side, and also the glenoid is damaged. You have the glenoid components which you put on the other side. So indications. Where will I be using a nerve prosthesis? When there's severe fractures and there's no management that can be done, you just have to replace. Also, vascular necrosis, also what severe arthritis of the shoulder, or probably they have been doing some other shoulder surgeries just to repair, it has been failing. So you just totally replace, okay, to permanently solve the problem. So designs will mimic the natural shape of the humeral head, and when it comes in there, it provides a lot of stability, you know. So historical importance, Neer's prosthesis has been used a lot, okay, worldwide. It has restored life to a lot of people, giving them hope. So it laid the foundation for modern arthroplasty designs. We have ones that are better than this, but this was kind of like the foundation to what we have today. So we must always what appreciate. So I think this is what we have for the next prosthesis.